Knee arthritis is a condition where the cartilage in the knee joint breaks down, causing pain, stiffness, and swelling. The most common type is osteoarthritis OA, which develops over time due to aging and wear and tear. Other types include rheumatoid arthritis, post-traumatic arthritis, and gout. Symptoms: pain and tenderness, especially during activity. Stiffness and reduced range of motion. Swelling and warmth around the knee. A grinding or popping sensation when moving the knee. Weakness or instability in the joint. Causes and risk factors. Age. Cartilage naturally deteriorates as we get older. Obesity. Extra weight stresses the knee joints. Injury. Previous knee injuries can lead to arthritis later in life. Genetics. A family history of arthritis increases risk. Overuse, repetitive motion or strain can damage the knee joint. Treatment: non-surgical medications, pain relievers, corticosteroid injections, physical therapy, weight loss, and supportive devices like braces or canes. Surgical: arthroscopy, minimally invasive surgery, partial knee replacement, or total knee replacement for severe cases. Prevention: maintain a healthy weight, exercise regularly, low-impact activities like swimming, avoid overuse, and adopt proper posture to reduce the risk of developing or worsening knee arthritis. For more, subscribe our channel and also push notification button for daily updates. Take care. See you in next video.